Hi, welcome to our inaugural Mondays with the Midwives. Tonight we get the fun of introducing everybody to the VCU Midwives. It's our Meet the Midwife event. Thanks so much for joining us live or joining us in the future. If you're getting up to pee at 2 o'clock in the morning or get a snack, we're so happy that you decided to tune in and check us out. I'm Leslie Feehan. I'm the lead nurse midwife with the VCU Health System Nurse Midwifery Service. And tonight what we're going to do initially is have all the midwives introduce themselves. I'm then going to run through a quick overview of midwifery and history of midwifery, and then a bit about the VCU Midwifery Service. And then we'll have time for the really fun part of questions and answers. But initially, I'll just tell you that our midwifery service is comprised of 7 people. We actually have 5 full-time midwives, 1 part-time midwife, and a midwife that works when we need her. We're a full-scope practice. So that means we see pregnant people prenatally, follow them through their pregnancy. We take care of them in labor and delivery and help them have their baby. We see women in the hospital on the mother-infant unit for inpatient postpartum care. And we also see folks postpartum for their postpartum care, which might be a mix of virtual or in-person visits. And we also do well person care and kind of benign gynecology. So we'll get started with introductions. And first, we'll go with Patty and let her tell you a little bit about herself.
Hello, I am Patty Mojak, and I'm one of the midwives on the VCU midwifery team. I'm currently in the call room, which is why the background looks a little bit odd, and I have a woman in labor, so I won't be able to stay long, but I wanted to be able to meet everybody and show you my face so that it's familiar. So I've been on the team for coming up on 2 years. And prior to that, I spent most of my nursing career in critical care. So it was a bit of a change to go from that to women's health. But learning critical care is very helpful in just about anything. So I have 3 small children. Well, I guess they're not so small anymore. They're almost 13, 9, and 6. And I think that's about it, unless there's something else that Leslie wants me to say.
No, I think that's good. What do you like to do when you're not catching babies?
I'm a runner, so I like to run, and I really, really enjoy playing with my kids. Most of my free time is spent throwing the football around or watching my daughter climb trees. I really, really enjoy just doing kid stuff. So that's the season I'm in, and that's what takes up most of my time.
I've seen you throw a football. You do that pretty well.
Hoggy just joined. Do you want her to kind of slide in? And
yeah, that's probably a good idea.
Because then we're going to have to get going to our patient.
Yeah, you guys might have to go with helping a woman have a baby, which I think is a big hallmark of what we do as VCU midwives is labor sit and really be with women in these moments. And so and they're going to switch, and I'll let Hagaranish tell us her story. You might want to take your mask off. It's just sort of hang in there. So if you just tell us a little bit about where you're from, educational background, what you love about midwifery, or what brought you here would be great.
Okay, well, I'm so glad to be here. I'm glad we made it for this call. My name is Hagaranish. Most people call me Hagi, and I'm new to Richmond. I've been here a month officially. My background, I'm Ethiopian, Californian. We're like our own special kind of Ethiopian. Grew up in California, and I've really lived all over the US, I think all regions, and have also worked in Ethiopia and multiple countries in sub-Saharan Africa. My undergraduate degree was in medical anthropology, And I was really looking at stigma and HIV, particularly around women and children and pregnancy. And I had a chance to work at the UN in my early 20s in Ethiopia. And that really influenced, I think, the way that I see public health and advocacy. And so that stayed with me, but I transitioned into more of a clinical role. And so from medical anthropology, I did get a master's in public health and international health and development, worked in that a couple of years as I was just kind of saying out of order. And then I went to UCSF for my nursing and worked as a NICU nurse and a med-surg nurse. I also apprenticed with home birth midwives and worked as a nurse at a birth center. And then I things happened, got married, had 3 kids. I have a set of twins that are 8 years old. I have 3 sons and then a third son who's 6. And I kind of came in as Patty was talking about this season of her life. And I'd say that that's really what colors my life is my children and my family. So yeah, I became a midwife just recently. I just finished as a new grad, but I've been in the birth world for 14 years. I'm a collaborator on Black Mamas Matter Alliance, and I'm a co-founder of National Black Midwives Alliance. Advocacy is important to me. It's a big part of who I am and how I use my voice, but midwifery is my soul. And so I'm excited to be nurturing that and coming back to what really feeds me, which is being with women and supporting families as they become, as children come through. So I think that's all the things. I think I even answered the midwifery question in my in my intro of myself. So that's that.
There you go. It's beautiful. Thank you so much for sharing. You can go be with that woman as you need to and help bring life into the world. Next, I'd like to present Tanya Baca and let her tell you a little bit about herself.
Hi, everyone. I'm Tanya Baca, and I'm originally from Albuquerque, New Mexico. I moved to Denver, Colorado after my sophomore year of high school, and I spent about 18 years out there. My nursing background, I started off actually as a nurse assistant back in high school, and I was in the geriatric setting in skilled nursing facilities for many years and transitioned into licensed practical nurse and then into the registered nurse role. And I primarily also stayed like in the primary care, ambulatory, OB-GYN, did a little float pool where you kind of dabble in everything. I've been a midwife coming up on 3 years after the new year, and I've been with VCU for the last year. We moved out to Richmond in 2018. So I have my master's in midwifery. I'm board certified, and then I most recently completed my doctorate of nurse practice. What I love most about midwifery is the honor of being welcomed into a family's life and their journey while seeing a person find their power and their courage and their ability. There's nothing else like that. So it's really quite an honor to be a part of folks' stories. And then something interesting about me, or what I like to do, I have 3 monsters, a 14-year-old girl, so it's all drama, a 9-year-old boy, and a 2-year-old little boy. My husband's from West Africa, and I have a big part of, even though I'm not from there, a big part of my heart is there. So I really love Ghana and just like to spend time with my family. We love the beach, and I'm a big Peloton freak. So RVA Pella Tribe on Facebook.
There you go. Thanks so much. Yes, I know. I see your Peloton successes. Wonderful. Thank you so much. We're so happy Tanya's part of our team. Next, I'd like to introduce Melanie Hartman and let her tell us a little bit about herself.
Hi, welcome everyone. I'm so glad we could do this Meet the Midwives. It feels like it's been a long time since we've got to introduce our team, and we have some new faces, and I really am so thankful for the women that I get to serve and serve with. I am a native Richmonder, but through California for a decade prior to coming back home almost 10 years ago. I've been at VCU since 2016, but I've been in women's health for 20 years. I was a labor and delivery nurse for quite a while and found my calling with midwifery and helping to serve women and bringing babies into the world. I loved stepping into the advanced practice role. In 2007 is when I graduated and became a full scope midwife. I really enjoy that piece of midwifery that I was missing as a nurse, in that I get to teach women about their bodies and fertility from the teen years until menopause, and the glory of getting to help women understand and patients, families, people to understand the magic around pregnancy, bringing a baby into the world, the transition into mothering, the hard and the good, the easy and the difficult. I have 2 children of my own, a 10-year-old and 11 as of yesterday, 11-year-old and an 8-year-old, and they are also the light of my life. I like to be in and around the water in every way, shape, and form. So we're always at the river and the beach and the lakes. And anyway, I love VCU. It's like my forever women's health home now, and I really enjoy being amongst this collaborative team. Thanks for being here tonight.
Thanks, Melanie. So sweet. You have such a great way with words. Thanks for sharing. Next, I'd like to present Holly McGrory, and she can tell us a little bit about herself.
Hello, everyone. I'm Holly. I've been with VCU going on 10 years now. In January, started as I'm actually from Florida native, but I've been in Virginia about 10 years. So I guess we can call this home now. I started in the intensive care unit as a new grad, and I did that for quite a while. And just as Patty said, you learn a lot about how to think and how to apply it to multiple areas in your life. I love helping women transition into motherhood, as it is quite an adjustment and quite a change. And something interesting is I'm currently learning how to mother 2 children. I have a 4-month-old that we just welcomed into the world in July. That's it.
Yay, thanks, Holly. And Holly is our as-needed midwife. She helps us because now with littler person, I don't know. Life's a whole lot busier for her. Thanks so much, Holly. And then next, I'd like to introduce Megan Noonan, and she'll tell us about herself.
Hey, happy to be here. I am originally from North Carolina, and I've kind of been circling the Central Virginia region for, I guess, the last 9 years. So I'm really happy to have found a home in Richmond. I had the opportunity to work with the midwives here back when I was training as a student, and always really knew that I wanted to come back to this group if there was ever an opportunity to do so, because it's such a special place. Prior to becoming a midwife, I worked as a nurse, first in pediatrics and then in labor and delivery, and have kind of found my way into this calling as a midwife. And I'm really happy to be getting onto this journey. I just joined the practice in June, so I'm still kind of getting acclimated like Hagi, but yeah, I'm really happy to be here. I really, like a lot of people said, really love the ability to have continuity with the families that we care for. So often we're introduced with a first pregnancy and seeing people through that and into next pregnancies, and then sometimes even beyond into the kind of post-childbearing years, which is a really special way to get to know people and families. In my free time, I'm currently in my dining room / reading room / yoga studio, because now every room has to have multi-purposes since we're mostly at home if I'm not at work. So those are the things that tend to occupy my time. Thanks, Megan. I love seeing you in your space. You got such a nice background. I think like you could be on like PBS. You got the best background. Thank you. And then there's me. I forgot to introduce myself at the beginning. I'm Leslie Feehan. I'm a certified nurse midwife. I've been a midwife now for 22 years. I was a nurse practitioner for 10 years before that. I'm really originally from Pennsylvania, but I've now lived in Richmond for, I guess, over 14 years. I lived here and moved away. I lived in Colorado for a while and then moved back. So I established actually the VCU practice in 1998.
and then left and went and established a practice somewhere else in the community. And I worked at a birth center for a while, and then I came back. Mostly because VCU really is such a great place to work, and it's so supportive of midwifery care, and the collaboration with physicians is so wonderful. So it's a really strong, successful midwifery program, and we're so happy to be able to have it and share it with women. All right. So we have a little PowerPoint presentation that I would like to share with you, just to go over a little bit about midwifery and the history of midwifery, just so everybody sort of has an understanding of that. This was our agenda, and we did team introductions, and I will go over midwifery care, and then specifically about us as the VCU Health Midwives. And again, then we'll have time for questions and answer at the end. The history of midwifery really is that midwives have been with women since the beginning of the time. Midwives usually were the traditional care provider, and not just of women, but really of the village, and they were the healers. As times change and populations grew and science grew, midwives were really pretty marginalized and pushed out of being healers, and also out of birth. There became the medicalization of birth, in that really people thought that it would be safer to have a baby in the hospital, and they trusted that medicines would make everything better. Some of that's true, but not all of that is true. And women were really disempowered in that, and they were no longer the focus and the center of everything that was happening. Really, the provider that was actually doing the delivery became the center. And women revolted about that a little bit, and they wanted to reclaim their own power. And also, especially in the 1920s and the 1930s, there was terrible infant mortality and maternal mortality. And midwives started to come back, especially in rural areas, poor areas, making a difference in maternal and child health. But also that in the cities, as women really pushed back against the medicalization of birth, families said, you know what, we're just going to have our babies at home on our own and have unassisted home births. And midwives really came back to serve that population, to keep birth safe and to be with women in their own environment. And today, as we look at modern midwifery really primarily is in the hospital, even though a lot of people think of midwives as being home birth midwives or out of hospital midwives. 98% of nurse midwives attend births in the hospital. And most of us do so in a full scope approach of taking care of pregnant people prenatally and then through labor. And it still is really a woman or pregnant person centered care, where the woman is our primary focus, and the midwife is listening and advocating and tending to her. There are three types of midwives. There are certified nurse midwives, which are registered nurses that have a graduate degree in midwifery, and they will have graduated from an accredited midwifery program. They are board certified by the American Midwifery Certification Board, and they are licensed to practice in their states. In the state of Virginia, nurse midwives are regulated by a joint board of medicine and midwifery. Nurse midwives have the ability to order tests, order labs, order ultrasounds, and have the ability to prescribe. So we can treat infections and we can provide contraceptions. Again, nurse midwives may practice in a variety of locations, though most nurse midwives practice in the hospital. There are nurse midwives who practice out of hospital birth, both at home and at birth centers. Certified midwives are very similar to nurse midwives. They usually, though, have a bachelor's degree in another field other than nursing, but they graduate from a graduate level midwifery education program that is accredited by the American College of Nurse Midwives. It's the same training as for certified nurse midwives. They also have the same certification that certified nurse midwives have through the American Midwifery Certification Board. However, they are actually not licensed in Virginia, and they are licensed to practice in many other states, but we don't have licensure yet for certified midwives. Certified professional midwives, there's two pathways for their education. It's apprenticeship training or it's accredited formal education program. They are certified by the North American Registry of Midwives, which is shortened to NARM. They take a NARM exam. They are licensed by the state, and in Virginia, they are regulated by the Board of Medicine. They also provide pregnancy, birth, and postpartum care. They are unable to prescribe in the state of Virginia, and usually they will practice in out-of-hospital birth settings. Sorry, I lost it. There we go. So the midwifery model of care really sees the pregnant person as a unique individual. It is that pregnant person-centered. The word midwife actually means with woman. So it is supporting that person through this journey, listening, educating, advocating for. It is a relationship-based care where trust is being developed through pregnancy, hopefully through pregnancy before labor, but sometimes that happens in labor. And it really is about acknowledging fears and working through fears, and also helping that person be in the best place they can be, both physically, mentally, and really spiritually as they get ready to birth. And midwives will protect, support, and enhance the normal and work to correct the abnormal. In our approach to birth, again, it's usually that pregnancy and labor are normal until proven otherwise. And usually the questions that we're going to ask is mom okay? Is baby okay? Is this labor normal? And if everything is fine, we don't really need to intervene. The labor and birth is really a natural process that the body knows how to do. Sometimes it does get off track, and we as midwives need to help get things back on track. We use interventions really more as intercessions to help support mom and baby. We do provide physical and emotional support. As you can see in this picture, there are a lot of hands on this woman. Usually are experts in using non-pharmacologic pain relief options, which may be positioning, using birthing balls, aromatherapy, music, dim lighting, hydrotherapy, using showers, using tubs, walking, doing lots of different things. And we also provide breastfeeding support or chest feeding support. The role of a certified nurse midwife is really health and wellness promotion and disease prevention. So again, it's a lot about education. We all are able to assess, diagnose, and treat problems. We provide physical exam, prescribe medications as needed, order and interpret lab tests, and of course promote services in the community and awareness of resources for people to connect with. Again, some lists of non-pharmacological tools for labor. This is a picture of a woman using a birthing ball and also having a doula present with her. There's dim lighting in the room, and you can kind of see it behind there. There's some Christmas lights just to soften the lighting in the room. Positioning is important. It not only helps take the woman's mind off of labor and give her something else to focus on, but it also helps babies navigate pelvises. So labor positioning can be really important to get that baby to move through the pelvis or to turn in the right direction to come out. Again, we use hydrotherapy a lot. Tubs and showers. Right now, we're not doing water births at VCU, but hopefully in the future at some point. And we're all strong believers in affirmations and the power of words and what we say and the power of the mind and what people believe. So we all strongly really believe in a woman's ability to birth and a baby's ability to know how to be born. So we work and say things to support that. We at VCU, our nurse midwifery service, we work in collaboration with a physician team. So we always have physicians available should we need them. Sometimes that may be prenatally if there's a medical problem or any other kind of problem and we need to consult with somebody. Sometimes we do need to have women have an appointment with a physician so we can work on a plan of care together. In labor, that may mean if something's going on that we're concerned about, that we invite the physician team into the room to give us their opinion or help us navigate the next step of care. If a baby seems to be having a hard time coming through, sometimes that collaboration may be a discussion of birthing options, such as helping a baby into the world with a cesarean section or an assisted birth with vacuum or forceps deliveries. We attend all our births downtown at the medical center, and we see pregnant people for care both at Stony Point and Nelson Clinic. And really people can go between both sites. It doesn't matter. Some people have preferences of where they want to be seen and some people don't. If you desire an appointment, these are the phone numbers that you can call. We also have a wonderful website that's vcumom.com that also have our pictures, but also have great information about midwifery care and really our approach to birth and our philosophy of care. What we know in choosing midwifery care is there really are some benefits that have been shown and pan out in research of decreased infant mortality, decrease in preterm births. We have a lower cesarean section rate and a labor induction rate. For us at VCU, our cesarean section rate as VCU midwives is 9.4% over the last year. Our induction rate is about 18%, and all of those are medically indicated inductions because actually we usually won't do inductions just for social reasons. And my joke about that always is just because you're tired of being pregnant, it's your great Aunt Sally's birthday. There really needs to be a medical reason for us to do an induction. We do let pregnancies go where people can stay pregnant till 42 weeks if everything's fine and wonderful. And we usually do try to do natural methods to get labor to happen somewhere around 41 weeks. We have a low rate of using anesthesia in our own practice. Our epidural rate is about 24%. You know, there is a time and a place for any intervention, including C-sections or anesthesia. So sometimes moms really need to sleep. Sometimes it hurts. Sometimes it's harder than they thought it was going to be. We have a low incidence of vaginal lacerations. Our third-degree laceration rate is about 1.4%. And in the last year, we've had no fourth-degree laceration rates. We also know that it can be a positive start to breastfeeding, and in studies that have been done, women have a higher satisfaction in care. Oops, sorry, I keep sort of clicking the wrong thing, forgetting I have a second screen. We often get questions about how care looks different or what's changed during COVID-19 pandemic. We still have the same level of professional and compassionate care. We are doing a mix of in-person and virtual visits, and that is really up to the woman and what her comfort level is, and also based on what her health risks may be of whether we need to see the pregnant person in person. We are trying to limit ultrasounds, so we lessen contact with the system to the best of our ability. Right now, today is March 22nd. As I speak to you, our visitor policy is women in labor can have 2 support people with them plus a doula. So 2 plus a doula. And then in the mother infant unit, they can have 2 visitors a day. As you can see in this picture, we're all wearing masks. The woman in labor does not have to wear a mask. We are testing all folks that get admitted for COVID-19. We are not separating moms and babies and haven't separated moms and babies during this pandemic. We are the only practice in the Richmond area that received a Triple Aim award from the American College of Nurse-Midwives based on our high breastfeeding rates, our low cesarean rates, and also our low preterm birth rate. So we're really proud of that. We've worked really hard to achieve that. One of the other specialties, not only of our practice as midwives, but really VCU as a whole, is that we offer group prenatal care. Right now, we're doing a model called P3, and that just is a particular model that we follow where we take women who have due dates usually within about a month of each other, and we see them prenatally at the same frequency as we would see them in a one-on-one visit. And then we also extend that into the postpartum period for a couple visits. The advantage of group prenatal care is you get to meet other women who are having babies at the same time as you. And you also get this wonderful social support that usually continues into the postpartum period. And our sessions are 2 hours, so you get a lot more time with a provider, and it's a lot more enhanced prenatal care and opportunity for education. We at VCU are a baby-friendly hospital, which means we have lactation support every day, 12 hours a day. All babies go skin to skin. All babies room in. The baby doesn't really need to leave the room for anything. Exams are done in the room. Testing is done in the room. And we also have lactation services outpatient at our children's hospital of Richmond. So we often get the question, well, how will I know midwifery care is right for me? There is a variety of midwifery care, but here at VCU, we are a low intervention practice focusing really on low risk to medium risk women who are looking to have an unmedicated birth. So the focus is trying to have a baby without an epidural. I already told you our epidural rate's 24%, so that doesn't mean we would ever withhold it, but we want the approach from the beginning to be that we're working to have a baby without an epidural. So what's your vision for birth? What are you hoping for? Would you like birth to proceed naturally? Are you trying to avoid induction? Where are you comfortable with birthing? Do you see yourself in a hospital? Does that feel safer to you? Would you rather be home or in some out-of-hospital location? Do you want broader pain relief options? Do you want to try things different than just moving to an epidural or even IV pain medicine, that hydrotherapy and showers and tubs, movement and massage, using birthing balls, acupressure points and those kind of things? And do you want to be an active participant in care? We really want to partner with women and help pregnant people move through this journey, but it also takes some participation on the pregnant person's part to read and to prepare or watch videos and take a class and seek resources that's going to help get her mind, body, and soul in the right place for birth. So now, hopefully I didn't talk too fast and hopefully I didn't miss too much. And it's time for questions. So one of the questions we often get is, what if I have some health problems but really want to birth with a midwife? That's certainly a hard thing to answer just generally. We would love to meet with you and review what the health issues are. And sometimes we will do co-management or collaborative care where we'll see a mom and she may see a general OBGYN physician or see one of our maternal fetal medicine physicians, which is really sort of our high risk docs. And usually we can work together. There are a few things that truly risk people out of midwifery care. There are some, but it's really worth a discussion. And if you're very committed to wanting an unmedicated birth, we really would love to have the opportunity to work with you. One of the questions that comes up, which Melanie, I'll probably let you answer if you don't. The question is, what if I've been receiving prenatal care elsewhere, but I want to transfer my care to the VCU Health Midwives? How does that work?
We actually get quite a few women who transfer in during their pregnancy. we have a general rule that we would like to see women by 35-ish weeks in the practice, and that gives us a chance to rotate through meeting the hands that might be there for birth and getting all of your records and making sure that we're a good fit for you and you're a good fit for us. I talk to women a lot about their vision of birth, and that oftentimes in that first half of pregnancy, it's, the first trimester is survival mode, and then we get through checking the boxes of normal and feeling movement and just the reassurances that come with, ultrasounds and making sure that all is progressing. And that's just the normal developmental stages of pregnancy. And come third trimester, we start thinking about how to get a baby out. So oftentimes that's the point that women like to transfer in for midwifery care. They start asking questions and realize that they want more support for their pregnancy journey and more support for their the birth and parenting journey. So we are more than happy to help you get yourself transferred over to VCU. And I think at the end of the discussion, we'll go back over those numbers of how to make an appointment by calling the numbers on vcumom.com and asking for a new OB visit with one of the midwives. And again, there's no commitment in that either. We have lots of women who come just for consult to discuss what their vision is and whether it feels right to be at VCU with our team.
Awesome, thanks. Yeah, we figured at one point it's almost about 22% of our pregnant folks transfer care to us in the late second, third trimester. So yeah, it's not an uncommon event. Tanya, maybe you want to field the next question. I've been really interested in a natural labor and delivery, but I've had 2 C-sections. Is that something you guys are comfortable working with?
Thanks for the question. Yes. So here at VCU, we are capable, it is within our scope to take care of women who are seeking a trial of labor after cesarean, and for those who have had 2 previous C-sections. What we do is we collaborate with the physicians, and we would ask that, you can establish your prenatal care with us, or if you're transferring from another facility, if you're currently pregnant, then, we would still establish care with you. We would ask that at some point you, like Melanie was saying, have records transferred, and especially your operative reports. And so we would have you meet with a physician, so that way the physician can go over your operative reports, and we can make sure that that it is safe for a vaginal birth after cesarean. And so at VCU, we can care for women who have had this, like I said. During labor, we do know that there are some risks for women who have had a previous uterine incision. And so we would request that we do continuous monitoring on your baby and your uterus while you're laboring. However, we have the portable waterproof monitors, so you can still be up doing your thing, getting in the water, in the tub, the shower. So yeah, we love to help women have a vaginal birth after cesarean.
Yeah, we take care. We have a VBAC success rate of about 78%. So we work really hard and believe strongly in women's ability, and really would love people to work towards a vaginal birth after cesarean. And like Tanya said, we just have to get operative notes and make sure things are safe. And we do monitor babies during labor and make sure babies are doing okay through labor. So yeah, thanks for that question. We're happy to help you. And so I got a question. One was, do we recommend home births? Well, we don't do home births. We are a hospital-based midwifery service, so it's not really up to us to recommend or not recommend, but there are home birth options in town, and you can certainly seek those out because that's a really individual assessment of what risks are and whether folks are candidates for that or not. We can, to make an appointment, often is the question that gets asked of how do we make an appointment. We do have 2 locations, which either number will take you to our centralized scheduling center. And it's, I think, flashing across the screen, so hopefully you can see the 804-828-4409. And say you need a new either OB or new prenatal visit, and you'd like to see one of the midwives. And again, we're at both places, Stony Point or Nelson Clinic. And we're at one of those locations every day of the week, Monday through Friday. Right now, we don't have evening hours or weekend hours, but we are there every other day. And also looking at the website, vcumom.com, that also has all the phone numbers and lots of information there. We attend all our deliveries at the VCU Medical Center, which is downtown on 12th and Marshall Street, something like that. And there was a question about someone who recently miscarried twins, and they're trying to conceive, and if they switch to us, would we do early ultrasounds to confirm pregnancy? I'm going to be very nervous with my next pregnancy. Yes, of course. Our focus is really individualizing care. And so it would depend on what each woman needs, and, basing care on her medical history, her pregnancy history, and determining timing of ultrasounds based on that. And then same with lab work. So, yes, we also have a pregnancy confirmation clinic. So sometimes we actually have folks seen in pregnancy confirmation clinic before they really start into their kind of prenatal care, so to speak. So that's sort of a easy way for us to get early ultrasounds when we really need it. One of the questions is, Megan, I'll let you answer this one. The question is, do I see the same midwife for all my appointments?
Yeah, so because we work as a group practice and not just individual midwives with our own people that we care for, we really try to encourage everyone to have the opportunity to at least have one visit with each midwife, because we also operate on a call schedule, meaning any given day, it could be any of us that might be there to attend a birth. And so we want to make sure that you feel comfortable knowing that it's a little bit just like the day of the birth is unknown. It's also a little unknown which midwife might be there with you. I think it's really nice to maybe have one person who might be like your point person, and maybe you've seen them the most, and that way you have a little continuity if that's really important. To you. But I think for everyone, that part of it is more or less important. It's just sort of individual, but at least meeting everyone. And so, all of our personalities. I think we all function kind of with the same midwife spirit and the same philosophies about birth, but we are different people and we have different personalities. And so it's nice to just feel like you have the support of the whole group.
Great. Thanks, Megan. Yeah, I echo that. And I always tell women, just like you want to know who's going to be there potentially on that day, we want to know too. We're sharing a major life event with you. So we really like to get to know you too. But we also understand people's schedules are sometimes limited and they can only get Mondays off. And, so they have to see people on Monday. So we just work it to the best of everybody's ability. Holly, I'll let you answer the next question. And the question is, how often do you see your midwife and for how long?
Oh, so we see it's just the same as normal prenatal care. And for all of you who are not aware of that, it's every 4 weeks until 28 weeks. And then from 28 to 36, it's about every 2. And then from 36 weeks on, it's weekly. And we've been mixing that up between virtual and in-person visits. Some of the visits that include lab work or ultrasounds, we'll try to make those in person. And then some of the other ones in between, we're doing more virtually since COVID. And then, of course, we follow you postpartum as long as you need us. Leslie has people she's seen through menopause now or going through menopause now. She's been practicing that long. So midwives,
making me sound old.
No, just showing the full scope of we can see you from your first period to your very last. and through on.
Mm-hmm. Yeah, that's a beautiful thing. Midwifery really does mean with women, not just women through pregnancy, but with women through all life transitions, whether that's just starting your period and maybe exploring contraception options or having some trouble with your period, through fertile years and what that may bring to you, and then through your final period, menopause. So it's really fun that we get to do a variety of things with women. Maybe I'll come back to you, Melanie. Another question is, how long is the hospital stay after having a natural birth?
As everything that we do as midwives, this is all family-based decisions. So shared decision-making. We really like our first-time moms, especially, to stay as long as they feel like they need to get comfortable with breastfeeding. Because we're a baby-friendly facility, it also we have the luxury of having a lactation consultant who's there every day of the week. So 7 days a week, there's somebody there. So we can make a feeding plan. So for first-time families, sometimes that is at least 24 hours. Occasionally that extends into a second day if they feel like they need more hands-on care. As long as everything for baby and mom seem to be well, then the decision's made with the midwife, the pediatrician, and the family about when they feel comfortable bringing their baby home. So that can be variable just depending on how things have gone and when everybody feels well, stable, and confident.
Excellent. Thanks so much. All right. I don't know if there's any other questions. Any of you ladies think of questions that you hear often and we should make sure that we address?
I just wanted to add one thing about transferring care, because it's always an issue, and this has been true of here and other places that I've worked, but getting records transferred is always the biggest headache for like everybody involved. So if you have the ability when you are coming for transfer to bring records with you, especially any ultrasound reports or any lab work, it definitely helps to expedite the process and also make sure we don't have to repeat anything unnecessarily just because we don't have the like paper proof of it. So I think that always helps things.
Yeah, excellent point. Thanks so much. And one thing I didn't mention is some of the afterbirth resources that we have. So we do follow up with women virtually. Sometimes that might be 2 weeks postpartum. Sometimes it's weekly for a little bit virtually if folks are having a hard time and we really want to stay connected to them. And sometimes we'll see people in person at 6 weeks. We also do have a postpartum support group called Getting Better Together. And they are doing virtual visit or virtual group meetings now. So that's a wonderful resource we have to support women in the postpartum period. All right. And this, of course, I'm also trying to read questions too. So it's, I feel a little schizophrenic a little bit. Okay, yeah. And to know that this is going to be posted on the VCU Health Facebook page. So it is going to be available for replay. Again, if you want to watch it again because we're so intriguing, or a friend, or you can tell a friend to watch it because, you know, everybody loves to connect a name with a face, right? And hear how we interact. And I think you can pick up some of our energy and really our passion for this work. And Melanie alluded to earlier that it was a calling, and midwifery care is really a calling. It's a passion because it's challenging hours sometimes. And we do it because of our love of it and our true belief in physiologic birth. And then again, just to remind you to check out vcumom.com and for more information and how to make an appointment, ask for a visit with one of the midwives and the team. The vcumidwife.com does have the list of the midwife names because I know sometimes it's hard if you don't know somebody's name. All right. Maybe I'll give it just a minute. You guys, anything else you want to make sure we mention about our service, about care. I have one more thing actually, because I know that everybody always worries about having a baby downtown and parking. It's probably the number one concern that we get. And see, everybody laughs because that is what we hear all the time. And we all answer that with, it just works out. It just really does work out. And nobody believes us. And guess what? It works out. It just really does work out. Most people labor at night. I always joke about we as midwives love the 8 a.m. start to labor and we have a baby at 5 o'clock, but that doesn't happen very often. It's usually 8 o'clock at night or midnight, 2 a.m. We're really used to our pager going off at 2 a.m. So there's not traffic and there's definitely parking available. We do have what do you call it? Valet parking, which is during the day, like 6 a.m. to 6 p.m. It's not at night, but there's always those entrances into the hospital to get in and that are opening, if you need to get in the building quickly. In labor and delivery, it is open 24/7. So there's always somebody there. There's always people to help you if you need it. And we're working whether somebody's in labor or having a baby or not. So just to know that, again, I think sometimes the parking scare keeps people away a little bit, but it really does work out beautifully. And we've even all met people at the door to scoop them up to labor and delivery quickly if need be. All right, I'll just make sure there's no more questions that we have.
I just wanted to also say we have a Midwives at VCU Facebook page as well, where we usually will update at least weekly, if not every other week, about our visitor policy. As Leslie alluded to in the beginning, even since the beginning of COVID, we have welcomed doulas as part of our birth support team, with also women being able to now have 2 support people as well, which is a big question I feel like that we've been getting a lot in our community as things evolve. I don't foresee that doulas and support people will ever fall off the list of people who are welcome. So, but that's a great place to go. Midwives at VCU is the Facebook page again, where we post info, COVID updates. Oftentimes that's a place that you can go to look for things like postpartum resources and public health care, just outside support services. Also, we link to the doula resources are in our community, childbirth education, those kind of things too. So our VA team.
Thanks so much, Melanie. I always do forget about that Facebook page. You do such a good job with it. Thanks so much. Well, thank you everybody for joining us tonight for our inaugural Meet the Midwives. We are going to start doing this monthly, and our next Meet the Midwife night is November 23rd at 5:30. And we really hope that you have a better understanding of midwifery care and how our team works and our collaborative model with our wonderful physician colleagues. And now that you know who we are and what we do, we really look forward to getting to know you better. So please don't hesitate to reach out. You can send messages through vcumom.com. You can send messages on our Facebook page. And we really are here for you. We have a strong service and we believe strongly in women's own ability to birth and care for themselves. And we're here to midwife folks through their life events. So with that, I'm going to say good night.
Good night.
Night.